Well, Dr. Wible, I'm really pleased to be joining you and to have you with us. And I've known of your work for quite a long time and looking forward to talking to you about some of the things you've done in the past and what you have been doing since your book. That's where I first became acquainted with you, was a book called Physician Suicide Letters Answered. And it talked about kind of the medical culture that often was kind of going on behind the scenes that most people didn't know about, but had impact on medical students and doctors. And it was particularly of interest to me because I was in my past, I went to medical school. I was wanting to uh, get a medical degree, go on to be a psychiatrist. And in the back of my mind, I wanted to help people like my father, who had taken an overdose of sleeping pills when I was young, because he had become increasingly depressed. And luckily, he didn't die, but our lives were never the same. And so I really had a sensitivity to that process. I went to medical school and dropped out of medical school because I found some of the pressures that I didn't know about when I went, but were really very obvious to me. So I'd be very interested just kind of in going back and hearing more about how you came to write the book. I think it's almost 10 years ago, and kind of what has happened since then in terms of how people have responded to it, and then we'll get into some of what's gone on since then in your work.
Well, the topic of suicide is not one that people like to talk about, but doctor suicide, I think, is a triple taboo topic because it's death, which is never a popular topic. I mean, I happen to I'm obviously attracted to morbid topics, which will become clear when I describe who my parents are. But yeah, death is not something that people want to discuss over the dinner table, and certainly not suicide, which is a sudden death that you don't want to discuss, but then you sort of have to deal with if it's in your family or whatever. And then your doctor dying by suicide, well, that's just a little bit too much for most people to handle because these are the people we're supposed to go to for help. And how could they possibly be dying by suicide 2 to 3 times the rate of the general population? And psychiatrists are pretty much number one on the list of if you were to rank the specialties as far as
Mm,
outpatient specialties.
mm.
Inpatient, like anesthesia is number one. Painless lethal means, right at your hands at any point. Same thing with veterinarians. I just want to share. They're both very high. Then surgeons, then emergency docs, then OBGYN. OBGYN, of course, they have to deal with stillborns, maternal deaths, all sorts of unexpected things, which cause vicarious trauma for which we can't get help without risking losing our license. But as far as outpatient specialties, like pediatrics, podiatry, all of that. Like psychiatrists are pretty much, they lead the pack on death by suicide. And if anyone listening is familiar with the wounded healer archetype, there's a reason for that. I feel like this is a trauma inspired profession. You hit on that in your career choice originally to become pre med and try to become a psychiatrist to help you understand your own father's path and maybe the path through your own childhood. So that's again something that's not discussed, which I think comes to the surface if you look through these suicide letters that I published. Most of the people didn't die by suicide who wrote me these letters. These are back and forth conversations of people mulling over the idea, the pros and cons. Should I not die by suicide? But I think anyone who reads that or who really investigates the reasoning behind person that would pursue a career in psychology, psychiatry, or medicine, it's usually because they've had pretty severe trauma as a child that could be their own health issues in the hospital a lot with asthma, and exposure to doctors, or a death of a parent, a mental health issue in a parent or a family member. So, yeah, I hope that sort of is a good intro
Yeah,
point.
absolutely. And so, yeah, tragic on all levels and often hidden, obviously, then and still, and not talked about for all the reasons you say. And you mentioned your parents. I know that your parents were in medicine. And talk a little bit, if you will, about your parents' background and kind of how you got interested in medicine and from, at least your own experiences and some connection with your own parents.
So my mom is a psychiatrist and my dad's a pathologist, and I was pretty much tagging along with them to work back in the heyday when you could bring your kiddos to the morgue, those good old days where you could just do child care in the morgue and at the psych hospital, right? So I would say that I was introduced to medicine. Obviously, I was in utero during my mom's residency, so I guess I was in the emergency department working with her. So maybe I overheard some really intense conversations. Who knows the impact of what's going on in the outside world when you're in utero? I think there is an impact there.
Yeah.
And so, yes, like literally, I had workaholic, emotionally unavailable parents who threw everything into their professional life. My mom, more for, I believe, security, financial stability. She came from very poor background. So, and she has underlying mental health issues due to like severe childhood trauma, which we won't go into in any grand detail, but that inspired her to choose a career where she could control her life more than she could as a poor child in an unstable environment. And then my father, as a Jewish man, immigrant parents, one son's going to be the doctor and one's going to be the lawyer. And he was assigned to go to medical school. So this was an assignment and he's a real mama's boy. And his mom told him to go to medical school. Well, he didn't say no. And he was born in 1923. He's significantly older than my mom, 17 years older, and she's from a
Mm,
different era. But yeah, so they both went into medicine, and I feel like they did a really good job in their perspective specialty choices. However, the problem for me as a child of a physician is that when you have workaholic parents who are emotionally disconnected, and I feel they have to build more and more of a moat around themselves just due to the volume of trauma that they're listening to at work, it makes it very hard to get, you might notice I'm an extremely emotionally and spiritually clingy, needy type person. And I didn't get those needs met directly by my parents. So I felt like as a child, I literally had to tag along with them to work just to have any sort of relationship with them
mm,
because they weren't home much and they didn't get along with each other and domestic violence. And I don't have to get into
mm,
all that. But the point is, in order for me, I truly felt in order to have a deep connection with each of my parents, I needed to take an active interest in their professional life and follow them to work. So
mm.
so I was a little intern, a little intern. My dad would introduce me as a doctor in training in the morgue to his, corpses, right? And leave me. He also had a job at the methadone clinic and the police surgeon interviewing drunk drivers before the breathalyzer. You had to have a live human nose sniffing people for alcohol back in the heyday of the pre-mechanical breathalyzer, which took over in the mid 1980s. So before that, if you were taken to the police station for a DUI, you had to burp or belch onto an actual doctor who would type on an old-fashioned typewriter what you smelled like. So
Yeah.
yeah, that I got a lot of exposure to seriously mentally ill people in state hospitals. I got to spend the night in the jail with my dad sniffing drunk drivers, in the 1970s, and then, the morgue.
Well, for many people, that would have turned them off completely to medicine to get that kind of exposure. It didn't turn you off, but as I understand it, by the time you were thinking of going into medicine, becoming a doctor, your parents discouraged you. They told you, don't do it. Is that accurate? And yet you went ahead
Yeah.
anyway.
Yeah, I think they were warning me about sort of the economics and the loss of control and autonomy
Mm,
that physicians would have in the future. And, maybe they were predicting we'd be taken over by venture capitalists and big
mm,
box clinics, and you wouldn't be able to have these very relationship driven style of practices, which they had. My dad was also a GP in Philadelphia before he became a pathologist. So, this whole relationship driven medical care would just I think they were predicting the assembly line medicine situation that we've fallen into. And so, yeah, it didn't turn me off. What happened, my early exposure to this revved me up in a way where I became desensitized to trauma the way most people would. I think because my dad was having so much fun in the morgue. He was really just he's a jovial, sweet guy. So I think if you're around dead bodies and it's unexpected, like in a war or a family member and everyone's crying, then as a child, you think, oh, culturally, this is not good and I should be sad too. But if you're with a man that's kind of like a happy Santa Claus type character, fun dude that is in the morgue and he's having a good time, I just never got this overlay that like death was bad or
Mm,
sad or, like I just felt like that was a stage in our many milestones in our soulful journey here and into the next world. And my dad is very philosophical. He majored in philosophy. So we would have conversations about what happens to the soul and, why people die and what happens next. And I think he just gave me this really grounded, calm, ability to be in otherwise tragic scenes that unnerve most people.
mm. It's fascinating. I know when I decided to leave medical school fairly early on, in order to leave, I had to see a psychiatrist in order to leave. They thought anybody that had gotten into medical school, and I had a 4-year full tuition fellowship, and it was like the dream of everybody, including me at the time. But it was clear to me it wasn't for me, and I saw a psychiatrist who, gave some reasons why I needed to leave. And glad I did. I, got into what for me was my ideal practice that started me out in another field. But for you, I want to ask a little bit more about at what point did you, having gone into medicine, begin to see that there were things about the medical practice that told you this is not the ideal? And in order to, in a sense, be a good physician and to be in the medical field, you had, in a sense, to reform or change, or at least make a different way of being for the kind of medical practice that you wanted. And when did that get to you? And then how did you then move into this looking for an alternative to what was generally being practiced?
Well, I was like you. You might not know this, but I signed the papers to leave medical school as a first year medical student as well. And I had to see a psychiatrist or somebody who had to sit with me, the same as you, to
Uh,
find out why I was leaving. And I actually officially left medical school. And I was just the problem is I didn't have any money. I had nowhere to go. I didn't have a plan B. So I was sitting on a bench outside the medical school library and my anatomy partner came out of the library and sat next to me, just kind of asking me how I'm doing. I said, well, I just signed the papers to quit medical school. I'm leaving. He's like, where are you going? Good question. I don't know. And I don't have any money. And so I was just like unsure what to do. And he, a very logical man who eventually did die by suicide
mm,
when he was in his 30s. The whole reason I'm
mm,
a doctor is because he convinced me, not really
uh,
convinced me. He just, with the logical male mind, I'm a very highly emotional, emotive person, right? So he just said, because it was obvious I couldn't leave. I didn't even own a car, and I had pets in my apartment. And where am I going to go? And how am I going to earn money? And what am I going to do? And, he said, well, why don't you just keep taking tests and see what happens? And for some reason, I thought, oh, well, yeah, I guess I could just keep taking, since I don't know what I'm doing, I'll just keep taking tests and see what happens. And then I graduated. So what unnerved me is the dog labs and the whole, we're going to murder animals as part of your training.
mm,
It was clearly not to learn anything that was going to be something that we use in humans later because they wouldn't have first year medical students carving on animals and giving them heart attacks and looking for heartworms. This has nothing to do with human health. This is a desensitization process. So that's what caused
mm,
me to want to quit medical school. But then after I started again, I began kind of a petition, a campaign to opt out of those labs, which was what was causing the problem for me. And I was eventually granted that. So I was, I guess, the only one in my class who graduated without murdering. And
Mm.
so that might be, it might explain why my soul is still in my body and my classmates just kind of actually methodically, I watched them become dehumanized.
I mean, it's so tragic, and it's we've all, I think, had doctors that we cared about who cared about us. That there was this other life that they had gone through, were still going through, that most of us just didn't know about and weren't aware of. And I mean, I was somewhat. It's interesting that I didn't know about you dropping out of medical school when I left. I also not I didn't have money. I didn't know where I was going to go, and when I talked to my psychiatrist, I had to make up some, logical story of why I was leaving. And so I said, well, maybe I'd rather be in social work where,
Mhm.
and uh, and so when I left, the dean had to sign off on my leaving and said, "Oh, so you'll be going across to Berkeley, where I was at UC San Francisco, to Berkeley to School of Social Work." And I didn't know where Berkeley was. I didn't know what social work was. And I said, yeah, that's." And so I ended up going across, finding Berkeley, and getting into school. And that was, a whole nother story for me. But for
Mhm.
you, over maybe you can say how long a period of time that you started to develop with your own people and then others, an ideal medical practice to teach and to give people an alternative who were doctors, who were practicing in situations that were less than ideal, that there was an alternative, there was something else possible. Could you talk about how you got doing that and how that process has gone?
Well, the alternative was simply going back to the original plan, like the way my father practiced in the 1950s and 60s. So it's not really an alternative, it's the original, right? What we have
Hmm.
recently had it replaced with is a less than ideal assembly line, very impersonal, robotic type of situation that I don't think really works for healthcare. I mean, maybe it works for manufacturing Toyotas. I don't know, but I think it was talk about a startling moment. At my first job, I felt like I really did feel like I was a factory worker, but yet I still had this high intellectual curiosity. I really wanted to research my patients after hours. I love going in libraries. I would sit in the medical library inside of our Sacred Heart Hospital here in Eugene, Oregon, that is actually just closed. We are the second largest town in Eugene, Oregon, and we have no hospital,
Yeah.
180,000 people, no hospital. But I would sit there, my first job way back in 1997, and I was in the library, and you'll never believe what I found because I'm one of these people that like mills around and looks at the titles and I get excited and I pull books out that I've never seen before. And then I'm the only one at the library in the hospital at midnight, put it that way. And so I found a whole section of books on Toyota manufacturing. Speaking of Toyotas, I don't know if you're familiar with like why would this was like, this is a Catholic hospital, so there's a section on the nuns and then there was Toyota, and I was like, wait a minute. I mean, of course, there were like nephrology section, psychiatry, but I just didn't realize I would run into auto manufacturing section. But when you open these books, do you have any idea what was in there or why it was in the library?
I don't know. Tell me.
Yeah. Well, I mean, my hit was, oh, wow, my feeling of being a factory worker. They must be modeling healthcare off of Toyota
Mm.
manufacturing. And so
Assembly
when you
lines,
open
yeah.
it, you open the book and it was this, you can even look it up, Toyota manufacturing healthcare. I think if you Google it, there was this kind of lean model of like, uh, I think at its baseline, it was about like for surgical procedures and other sorts of procedures, preventing mistakes and having like a protocol, kind of like how I guess in manufacturing automobiles or something like that, or planes, like there is a protocol for doing transplants this way or protocols and procedures that would create a lean, error-free model. However, you can't exactly lift that and use it in primary care where people are coming in for emotional and spiritual reasons that are manifesting in physical problems. So I think I just felt like, oh wow, I this is actually modeled after automotive manufacturing, and it's not really working for primary care. I'm not going to judge whether it works in other specialties, but I can't imagine psychiatry being modeled after Toyota manufacturing and ever have it work.
Exactly. I know for me, just when I left medical school and got into social work and graduated and started my own, what for me was an ideal practice where I was doing the kind of help and support that I thought was needed with drug and alcohol addicted people. And then we got visited. We got very well known and were visited by all kinds of people wanted to know how we were doing it and to, see what the model was that they could use. And I got a group of medical students that came, and as I was getting ready to talk to them, one of the guys had been talking to the students, and it turned out it was my medical school class, my actual medical school class that I had begun with. Four
Wow.
years later, they were graduating and now out in the world. And I got talking to them, and a number of them had said, I wish I had left when you did. But
Right.
now I'm a doctor, I'm in the system, I've got loans to pay off, I've got all this kind of things, and there just is no other choice.
Mhm.
And back then there wasn't, and I'm just real interested in what you were able to create because that isn't well known. I don't think a lot of people even now understand what you created was opportunities that there really was ways that doctors and medical people and hopefully others could create the old time practice, if you will, that
Right.
used to be before all the assembly line medicine. What did you do and how is it going? What
Oh,
happened since then?
well, I mean, I landed in a state of suicidality in that first job, the Toyota manufacturing scenario, because like it just wasn't working for me. And just witnessing kind of it just, even though there was the Catholic sister and the dove and all that, and it looks great on the outside, I don't know. Do you know the phone number for the billing department is 1-800 you are fucked. Like, I mean, it's just, like you are. Yeah, I mean, it's there. I would say the hypocrisy of what I was experiencing versus what I created the oath, the Hippocratic oath, what I stated I was going to do, what I imagined what I was that I would do, what I wrote on my personal statement on the way into medicine. I felt like it was all scrapped, like my good intentions, my soulful longing, the whole meaning, the reason why I went into medicine was just held hostage to get me in, but there was no ability to really practice the way I had wanted to, that I had imagined at the beginning. So, out of the suicidal state that I had, I just decided I'm going to go back and ask my patients what they want, and I'm going to actually let them write my job description for me because the people that are currently writing my job description have a very divergent ethics and goals that I have. But I felt like the goals that I have and the goals that my patients have are probably more aligned. So I just went and did a series of town hall meetings back in 2005, like nine, how many did I do? I collected over 100 pages of written testimony over a period of 2 months, going and sitting in people's living rooms, listening to what people want, going to co-op housing, going to churches, and just listening to people. I would call them listening sessions, I guess, but it felt really kind of political in a way, town hall meetings, because I'm going to listen to what people want and actually do what they say. So this isn't just you know, listening to people without an end goal. And I told them all, look, I'm a doctor in town. I'm not leaving town. I love my profession. I love helping people. You tell me what you want. I'll do whatever you want as long as it's basically legal. And what they wrote was just awesome. And all I did was follow. I mean, I could even get out of the drawer and show you and read out of, it's just so beautiful what people wrote. And I was able to adopt 90% of all of these great ideas with no outside funding and open 1 month later. And so that's the
Mm.
missing piece, is really what people want is just eye contact. They want to be treated like with dignity and respect and listened to and not be cut off in the middle of their first sentence. And it's so funny when I'll talk to people and they'll ask, well, what's the secret? Like what after all this and you got all these 100 pages, what is the secret? Well, like, what do people really want? And what they really want, this is the secret, is they just want answers to their medical problems. Like, that's the secret. And if you do that and you smile and make eye contact and really care, that's all people want. It's actually very simple. But we've had all these third parties insert themselves in ways that my parents sort of forewarned me that I wouldn't like. And that's what's causing the problem. They're taking a huge chunk time wise, having to do prior authorizations, this, that, and the other thing. They're taking a chunk of the money, and they're just leaving us in, 7-minute visits that sometimes are double booked. So everyone gets 3 minutes. And how can you possibly answer their medical problems or even be kind in that time crunch?
Indeed. And so it worked for you, but I know that you've been able to teach this to others and to help
Right,
other people. It isn't just you've got a great
right.
ideal clinic in your part of the
Yeah.
world in Oregon. How many other people have you been able to help develop their
Well,
own practices?
I mean,
And
hundreds, if not over 1,000. The thing is, I had to stop tracking it because it was so time consuming to keep track of all these clinics. I once had a map on my website with little dots all across the country.
Mhm.
But then, that means I'm having to like update their websites. And I couldn't manage my own ideal clinic
Yeah.
and ideal life and, promote all these other clinics. But leave it to say, there are a lot of doctors that choose independent practice over selling their souls to the machine, which is not pleasant for people trapped there as doctors, nurses, patients, or whatever. And so I would say it's probably 1,000 plus. I mean, because there's
Mm.
people that contact me that say, I read an article that you wrote. They never took a class with me.
Mhm.
I think just by me doing this and writing about it and promoting it, it gave other people the idea they could do
It's
it.
possible,
Yeah,
exactly.
yeah, yeah. So I think that served its purpose. And then, I know for sure 600 people have gone through my programs and the retreats and the seminars and opened their own practices. And then
Mm.
I'm just not tracking it, but I'll say that
Yeah,
people who have done this are very happy. They're
I
very
can
happy, and they would have left medicine had they not done this.
exactly. And that's, I mean, to me, it's just it's the way it ought to be. It's the way
Mhm.
that we believe medicine should be, and to know that there's an alternative, I think, helps patients who are looking, and also doctors and students. And so beyond that, I was interested. I'm on your mailing list, and I got a kind of New Year's or first of the year announcement of something new that you were doing that really perked me up because, I was in medical school back in the day, and I wished back then I wished I had had a medical school that did real medicine and taught you the human things that somehow have gotten lost and
Mhm.
that I read, and I want to hear more about your announcement that said you're starting a medical school after getting lots of requests. And again, just the idea that a person could start a medical school and it could be the kind of medical school that people could actually go to and learn from and develop the kind of ideal practices that you and others were able to develop to me is like a miracle. We don't hear even that that's possible. Everybody complains about current medical system and why we're not healthy and all of that. So tell me about how did that come to be and what have you been doing since the first of the year to start a new medical school?
Okay, so I do want to say, and this is something that I teach with the people that are launching their own ideal clinics, which is you don't need to replicate what already exists and is done well. What you're trying to do, like if you open an ideal clinic in your community, you're trying to deliver what's not available, like fill the unmet needs, right? So, for example, people can get vaccines and medications at the pharmacy. So, I mean, I guess you could dispense them in your office, but that's going to take you a lot of time and that's going to duplicate a service that's already available in your community. So, with this medical school, which is a medical school, but it's not an accredited traditional medical school, it's not going to prepare you to go to residency. It's not that kind of medical school. It's filling the gaps that are not offered in current medical schools, which is why I call it the Live Your Dream School of Medical Arts, because I've been teaching Live Your Dream teleseminars and retreats for physicians all along. It's just I'm sort of wrapping it up into what it actually is, which is a school designed to help people actually either utilize their current medical license to practice in a way that's in alignment with their soul's purpose, that leaves them fulfilled at the end of the day, at the end of the year, so they actually have a full lifespan as a physician and their patients benefit. Or there are people who, like you and others, decided to leave medical school or leave their residency and didn't finish the training, but they still have so much wisdom to give. There are ways that you can practice and open a health related practice without a medical license. I actually retired my medical license in 2021, and now I solely do coaching. I guess you would say it. I don't really like the term coaching, but it's just kind of, if you had to use an umbrella term, I guess that's what I'm doing, teaching, coaching, and helping people live their dreams as health professionals with or without a medical license. Because I'm dealing with people that now have been sent to prison after being entrapped in insurance fraud schemes that they didn't even know they were in, because doctors are just looked at by the outside world as sort of a lottery ticket, whether you marry them or can get them to use their Medicare number in a fraud scheme. And so a lot of doctors have not only sustained the vicarious trauma of whatever they've witnessed in training and watching patients die, but there's a trauma of being seen like the money bags for everyone else and then getting taken advantage of by scammers and all of that. And it's just sad to see these people die or give up their careers because they have so much they can still do, even without a medical license. So I would say what the school is all about is teaching people business ownership, entrepreneurial skills, which they don't teach in medical school. They want you to be an employee, right? And also medical legal strategies so that that you can avoid being scammed or doing things that are illegal that you didn't know were illegal, and now you've lost your license. Ways of getting basically mental health support in a non-pathologizing environment where you can actually get peer support and not be an electronic medical record, all sorts of things that we teach. I feel like without these things, people could lose their careers in 10 minutes by a frivolous complaint by an angry patient that they don't properly defend against, or a mad spouse in a divorce situation that now tells the board that, oh, I think she takes marijuana gummies, and now there's all sorts of ways that physicians could lose everything that they've invested their career in an instant. And I just don't want people to die by suicide. So the purpose of the school, in essence, is to help people have the normal longevity you would have in your career because you enjoy your career and you used your license and you create your own destiny with it. Or God forbid, your license has been taken from you for some reason. You don't need to die by suicide. The wisdom that you have can never be taken from you. And there's so many other ways that you can help and heal on this planet. And so it's really, yeah, it's the school, it's the missing piece.
That's so good. I have two just real quick stories that triggers for me. One is I have a doctor who I've seen for years who is attached to a hospital in where I live, and I've been seeing her for years, and all of a sudden I found out she was no longer there, and kind of mysterious. It wasn't announced exactly why she left, but she was no longer at the hospital. They would be hiring a new physician. And it was like, but that's my doctor. I've been seeing her for years. And it turned out that she was involved in some kind of prescriptive thing where she had narcotics or something that she had prescribed that were legal, but there was a whole sting that went on that she got caught up in because she had got, and so the hospital had to let her go, even though
Right.
she didn't do anything wrong. They didn't think she'd done, but whatever the legalities were with the hospital, they had to fire her.
Right.
And
It was a CYA act on the hospital, and literally she probably had undercover DEA agents come to
right.
the
Some,
office. Yeah.
something like that. And
Yeah.
so she didn't lose her license, but she was no longer there and I couldn't see her anymore. Well, it turned out she got hired by and started another clinic that I was in fact, just a couple of days ago, I saw her for the first time and now I'm back to seeing my doctor. The
Wow.
other, kind of story related to what you're saying is I had seen a psychiatrist for years because of my own issues from my traumatic childhood and my father. And I had, gotten good help from her. And then I found out she had retired from being a psychiatrist and decided, the license and all the professional stuff. And she went into being a coach, as you described,
Mhm.
to simply get out of the system that was no longer working and still be able to provide the health services that she wanted to, had been trained for. So it sounds like this is something that's beginning to happen in, kind of little pockets here and there, which is really, really just exciting because uh, we need it in so many levels. And in
Yeah.
my profession, I did get out of medicine. I don't have a medical degree, but I went back to school after my social work degree and got a PhD in international health. But both psychology and social work are still very influenced by the kind of medical model, not to the same degree. But I'm wondering in your practice, in your school, whether you're either now or contemplating or have any way of sharing some of your expertise with people like me who may be in not medical doctors or students, but have some of the same desire to help people and some of the same things we need to learn about all the things you describe. Is that going to be part of
Yeah.
your school or is it now?
Yeah, yeah, it's open to anyone who, like, I'm not training auto mechanics, but
Yeah.
anyone who's got a health professional sort of background, PAs, NPs, social work, like anyone that wants to join for anything that we're doing is absolutely welcome to join us. It's not limited just to MDs,
Oh,
DOs,
that's
any of that. So, and it's along the entire lifespan. Some people they just want to come and they're like nearing retirement or retired. Other people are, there's a Canadian medical trainee in the group. There's people from other countries. So it's really kind of beautiful because, the medical school in the US is just for US students, and you have to go through the whole MCAT, and it's a whole, there's no real prerequisite other than a desire to help human beings and to be the best healer you can be and guide and teacher. And so yeah, and I do vet people. I mean, I actually have to talk to them and make
sure.
sure they are who they are. And
Right.
I'm very protective not to have anyone, say, from a medical board sneak in and then overhear the, the conversations on people's suicide attempts or whatever. So
Yeah.
but it's just these curated, facilitated groups of people healing together and small Zoom sessions. It's so fulfilling. I just
Mm.
love it. I love, love, love what I'm doing.
That's so good. So, it sounds like, and it makes sense that this is not the old style. Like when I went to medical school, there was the big, university hospital, medical school up on the hill. In my case, physical locale, you had to be there in person. It sounds like your school is available to people who may be living in different places and you do it like we're talking
Mhm.
on Zoom or so. Is that, and
Yeah.
what's the nature of what are there classes? Are there
Right.
courses that you can take or
Yeah, yeah.
how
There's
does that work?
courses. There's even continuing medical education credit. It's category two, kind of self determined credit, but you spend
Uh,
a certain number of hours. Like since we just started in January, we had our first class was Pathological Perfectionism 101. And the way we set this up, Jed, is how book learning doesn't quite stick as much as learning from a real human being who's really struggling with the thing that you're learning, right?
yeah,
So the way this is set up that's unique, and I think it's very unique, and I don't know that anyone else would want to do this, would want to try to pull this off, but these classes are essentially they're month-long classes, so they're just 4 sessions that are usually 90 minutes, sometimes go on for 2 hours, but they're literally they're psychological autopsies on physicians who've died. So like Jonathan Drummond Webb, if you've read any of the stuff that I've sent out on him, who was an amazing pediatric
Yeah.
cardiologist. So when I say that he was teaching the class, I mean, it's inspired by him and guests. His wife was in the class, and she said
Mm.
she learned so much and felt such a connection with her husband through learning about and talking about the pain that he endured and what led to his suicide by perfectionism, essentially. And so that allows other still living people to have a piece of Jonathan in them and recognize, oh, wow, I might be going down the pathological perfectionism route like he did, and I don't want to die prematurely. So it's not like me sitting at a podium. It's not, it's like a group learning experience based on honoring, and this is really important because the oath that we take when we complete medical school, we're honoring our teachers, our ancestors in medicine, and we are supposed to be doing that. And that's the opposite of what's going on now. People vitriol every different way, market competitors, vindictive peers, you know what I mean? And so I'm really getting back to the original Hippocratic Oath, which is honoring our ancestors, even our deceased physicians, learning from them what they have to teach, because let's just face it, they have a lot of free time now as free souls. And there's a lot we can learn from them, even by studying their writing that they left behind, even their suicide note. There's a lot we can learn that will only help patients and physicians who are still needing true healing environments. So,
That's just does my heart good to hear that and to see that and to know that this is existing at this kind of time in human history where we need it, more than ever. It's just something that I think everybody is looking for, and when we hear it, we want to be part of it. We want to know about it. We want to spread the word. So before I just want to, find out how people can be in touch with you, but I'm inspired just by the times in which we're living because I hear again, there's kind of two edges to the times we're living in. I listen to you and I'm just so inspired by, what you're doing and what I'm doing and what others that are kind of looking in, going back to the future in a way, back to some of the healing practices of the past that really were healthcare.
mhm.
And then looking to what can be created in the future. But we're also living at a time, certainly in this country, in the US, as well as other countries in the world, where, there is such a dysfunctional system, not just medical system, but the larger systems that we're a part of. So I wonder if you could say something about the times we're living in from both the problems that are being created and how they often manifest in uh, unhealth and people getting sick, and at the farthest edge of feeling that life is not worth living, and suicide is response to that feeling of helplessness and hopelessness. What do you see going on both in the problems and then in some of the solutions that you're seeing in what you're doing and maybe what others are doing that can give us some hope?
Well, I think it does look pretty dismal if you're somebody that's not spiritual and you don't see this human life as a spiritual experience in a rented out human body that you're in short term, right? I think some people, like my ex-husband, this is his theory, that you're either in the lunch line or on the lunch line. You're either eating food or you're being eaten. Like it's pretty much like he didn't believe in any kind of life after death. And the fact that I would talk about my deceased ancestors in present tense really unnerved him. Boy, did he not like that. I didn't even realize I was doing it. He's like, why are you talking about your grandmother in present tense? She's been dead for 10 years. And it's like, well, I guess she's still having an impact on me. I still feel her presence. So
Yeah.
what I feel like the times that we're living in call for is a spiritual awakening in ourselves collectively, individually, as nations, that any kind of turmoil that comes our way is literally for our spiritual growth. And I personally believe we choose our parents before we're born. We set up the circumstances of our life before we get here. And these things that are presenting themselves to us They're just a nudge from the universe, from God, from whomever you believe is on the other side to help you be the best person you can be in Earth School. Because, yes, I have a Live Your Dream School of Medicine, but that's within the greater Earth School that we're all being homeschooled every minute of the day. And how we're going to respond to the tension and the friction and the emotions coming towards us, and how we can stay calm amid the storms that we find ourselves in. This is like the grand lesson of life. We're all, to choose to be here at this time, I feel like we're all getting a PhD in Earth School. And so I just want to inspire people to think in an expansive way so they don't implode upon themselves and go into a hopeless state, because that isn't really why you're here, in my opinion. We're not here to go into a state of isolation and self-harm. We're here to learn everything we can and seize every moment that we can in connection with others to make sense of what we're going through collectively. And yeah.
I think I so agree. I mean, that's what I've learned. My initial kind of path was getting out of medical school quickly and early on, and being able to find some of this spiritual way of being that wasn't available to me. And I'm probably the best investment I ever made was giving back the money that I needed at the time. And at the time I was facing the draft. So not only was I not having any money, but I was facing, if I left medical school, I might end up, going off and having to kill or be killed. And I had to deal with that at the time when I left medical school. But now, I survived, and I'm at a place kind of where you are, where I'm wanting to pass on some of what I've learned to the next generations and create, places where particularly men is kind of my focus, both because of my father and my son and myself as a man, but all of us that, are living in systems that are not life supporting and don't broaden us into this larger spiritual realm of which we're part of. And I agree, we've been here before, and there's ancestors that live in my being and teach me every day.
Mhm.
So if people want to, I will be, as I told you, writing an article and sharing this with my audience. But for this, how can people reach you if people want to learn more about what you're doing, about the school, and about just the various ways in which people can see that we have a different way of being in the world? How can they
Mhm.
connect with you?
So PamelaWible.com or idealmedicalcare.org kind of lead to the same ultimate location, where I have the every month the new schedule for our school. Everyone's welcome to join. I mean, if you're in high school or college and you want to learn how to launch your own business and help people heal. I mean, I think we're all just kind of helping the mini me's of us, the people that are a few steps behind us. We're like the Sherpa for them up the Mount Everest. So yeah, that's where you could reach me. And when we get off, I'll send you a few different things that I think are highly relevant right now that might even lead to a subsequent interview. I have somebody that you might want to interview, a man
Super.
who's really inspiring. So yeah, I would love
Well,
to talk to anyone who wants to reach out to me.
super. Well, I will, and we'll stay in touch, and I'll look forward to getting more. So for now, I'm going to stop this and uh, stop the recording for now, and we will